COVID-19 vaccine. With an increased supply of vaccines, we will continue to make it easier than ever for those who are most at risk of COVID-19 to receive a vaccine. This includes our frontline healthcare workers who have been working courageously around the clock to keep our communities safe and care for patients suffering from COVID-19. As early as May 14th, high-risk healthcare workers will be eligible to book and receive their second dose of the COVID-19 vaccine earlier than the recommended 4-month interval. As we continue to fight the third wave of the pandemic, we are truly grateful for the sacrifice of our healthcare heroes. I also want to address the recent decision to pause the rollout of first doses of the AstraZeneca vaccine. This decision by the Chief Medical Officer of Health was made out of an abundance of caution. Those of you who received your first dose of AstraZeneca did the right thing to protect yourselves, your loved ones, and communities, and vaccines remain our best defense against this virus and our way out of this pandemic. I know many of you are wondering about your second dose. Data out of the UK shows a dramatically reduced risk of the adverse reaction called VITT in second doses of AstraZeneca, and we are also seeing promising results of administering a second dose of a different vaccine. We look forward to providing more guidance shortly. And I know many Ontarians are excited to enjoy the warm weather and see family and friends, but for the time being, it remains critical to continue following the public health measures. These measures will help to keep us safe while we vaccinate even more Ontarians. There is reason to be optimistic, and we are making good progress in defeating this deadly virus. Thank you, and I'd now like to hand it over to the Solicitor General.
Thank you, Minister Elliott. Ontario continues to make tremendous progress on the vaccination front. The predictable and increased supply is enabling our province to protect more people from COVID-19 and significantly reduce pressure on our hospitals. More vaccines also means we are able to reach a greater number of people through an expanded rollout at local pharmacies. At this time, nearly 80 pharmacies in Peel and Toronto are offering the Pfizer vaccine, and up to 60 pharmacies in Durham, Hamilton, Ottawa, Windsor-Essex, and York region are now offering the Moderna vaccine to individuals aged 18 and above. This initiative will continue to expand on a weekly basis, with almost 2,500 locations to begin offering the Pfizer and Moderna vaccines by the end of May. We are also making strides to help speed up vaccinations in hotspot communities by continuing to work with public health units and employers to get more people vaccinated. Workplace vaccination clinics continue to operate for employees who cannot work from home, as well as providing additional vaccine access in hotspot communities where they are located. Building on these access points, a workplace vaccination clinic has been launched this week at Bruce Power, located in the Grey Bruce region. This facility is critical to Ontario's electricity supply and is a key supplier of medical isotopes used in personal protective equipment sterilization. Additionally, last week, mobile units began vaccinating workers at small to medium-sized workplaces in York, Toronto, and Peel regions. And in the coming weeks, these mobile units will continue to administer vaccine doses to thousands of workers by visiting workplaces that support the food supply chain, manufacturing, transit, as well as postal services. This robust and sustained vaccination campaign, the largest in Ontario's history, is critical to protecting our communities and stopping the spread of COVID-19. Although we are making encouraging progress, it is important that all Ontarians continue to follow public health measures. Our collective efforts and continued diligence have made an important difference, and we must continue to stay home to save lives. Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
First question comes from Adrienne Gabriel at City TV. Please go ahead. Hi, thanks so much for taking my question. When it comes to the AstraZeneca shot, if I have received my first dose of AstraZeneca, will I have a choice to either pick Pfizer for my second dose or AstraZeneca for my second dose? And furthermore, if I want AstraZeneca to be my second dose, Ontario is getting about 250,000 doses next week, even more next month. Are we going to move up the timeline so people can be fully vaccinated? It doesn't seem to make much sense for those doses to just be sitting around.
Well, first, we have just a very small number of AstraZeneca doses on hand right now, and also the Chief Medical Officer of Health has put a pause on administering more first doses of AstraZeneca out of an abundance of caution. And so we are waiting for the determination by Health Canada as well as NACI on the situation with respect to the VITTs and the safety overall, although that is what we need to know more about before we deal with any more doses of AstraZeneca being put into arms. But we certainly have quantities of both Pfizer and Moderna. We're also waiting for NACI to review the UK data, where there has been intermingling of vaccines, AstraZeneca and others, to determine what should perhaps be the best second dose for people who have received AstraZeneca. I am in that category myself, having received the AstraZeneca shot first, but we know that the second doses aren't coming up until the end of June, so we certainly have time to consider all of this data and await the results and the recommendations of both NACI, Health Canada, and of course our Chief Medical Officer of Health.
Follow-up.
It appears that the last 2 weeks, the prioritizing 50% of our vaccinations to hotspots has been a big success. We've seen the percentage of those who live in hotspots and who've received the first dose actually increase and is now 5% higher than the rest of the population in the province. If that's really where the fight right now remains in Ontario with COVID-19, why isn't the province looking at extending, prioritizing these hotspot communities for another week or two so we can get even more of the individuals in those communities vaccinated?
Well, we have seen this rollout being a great success, with having people in the at-risk communities receiving, in some cases, 5% higher rate of first dose vaccinations. However, I think it's also important to note that we are receiving almost double the number of Pfizer doses for the month of May and into June. And so when we go back to 100% distribution across the 34 public health units based on population and based on risk, that we will still see a very large number of vaccines going into those at-risk communities. And so we're going to continue with the progress that we've already made.
Next question.
Next question comes from Mike Crawley at CBC News. Please go ahead.
Hi, thanks for taking my question. Minister Elliott, I'm a little confused about what the plan is for these 250,000 doses of AstraZeneca that the province is going to receive next week, and the 50,000 doses that are on hand currently. So that's 300,000 doses. What is the province's plan what are you going to do with them?
Well, for the moment, with the small number of doses that we already have, we're just holding on to them pending the final review by NACI and Health Canada. As far as the doses that will be available during the week of the 17th, that is something that no final determination has been made as yet as to whether they will be received in Ontario. So it's all pending the review by NACI and Health Canada.
Follow-up.
Can I ask about the children ages 12 to 17 getting their vaccinations in June? Do you have a sense of to whether this is going to start in early June, or is it going to be later June? And is there going to be a prioritization of kids who live in the public health units that are most affected by COVID in the GTA?
We are actively working on the vaccine rollout plan for 12 to 16-year-olds with the Ministry of Education and working with our public health units as well. This is extremely important. We want to make sure that our young people can receive the doses as soon as possible. So we will have further information very shortly on that when the details are finalized.
Next question.
Next question comes from Jeff Gray at the Globe and Mail. Please go ahead.
Oh, thanks. I just want to follow up on those doses that we have and which are on pause of the AstraZeneca. I haven't been able to sort of sort out the calendar in my head, but is there a concern that some of those doses are going to expire before we're able to get them into the arms of people for second doses, as seems to be possible? It seems to be that it will be safe to do second doses with AstraZeneca. Is there a commitment to use those doses without letting them go back?
Well, as Dr. Williams, our Chief Medical Officer of Health, has advised, that we don't proceed with any further administration of AstraZeneca doses at this moment. We will hold on to them, but it's all going to be pending receipt of the recommendations from NACI and Health Canada. We don't expect that there will be any or perhaps just a few doses that may expire. However, this is out of an abundance of caution because the safety and well-being of the people of Ontario has to be our top priority.
Follow up.
And just follow up, Minister, you touched on this in your remarks, but the whole story with AstraZeneca and the issue of vaccine hesitancy, I wonder if you could just address that a little more. You know, are you concerned that all this back and forth about this vaccine will make that problem of people being reluctant to get a vaccine, will make that an issue, more of an issue?
I don't expect so. I believe that most people want to hear what the medical experts have to say about both the safety and efficacy of AstraZeneca. And so depending on the recommendations that we receive from NACI and Health Canada, if they do indicate that it's safe to continue, we haven't seen this be a problem in the past when AstraZeneca issues have been raised before. But again, it's all pending the determination by those bodies as to whether we should continue or not with AstraZeneca.
Next question.
Next question from Dave Woodard at Global News Radio, 640 Toronto. Please go ahead.
Good afternoon. Minister Elliott, regarding mixing of the vaccines, when are you expecting NACI to make their decision on it? And do you think that one study in the UK is enough to go on to make a call that mixing vaccines is safe?
Well, I understand that NACI and Health Canada are looking at the UK study, but they're also looking at their own evidence that they have, medical evidence, because we want to make sure that a decision when it is made is going to be safe for the people of Ontario and efficacious. We want to make sure that if we're going to be mixing AstraZeneca with something else, Pfizer, Moderna, or any other vaccine, we want to know that it's going to be effective to protect people from COVID-19. So we do have time. We know that the second doses for the AstraZeneca patients don't begin until late June. So we still do have time to consider it and for NACI and Health Canada to review all of the available evidence.
Follow up.
Okay, thank you. And the technical briefing talks about children over the age of 12 getting their vaccines, and the target for this government is to get that started in June. But based on the 4-month lag time between shots, it means that they wouldn't be getting vaccinated until October. So does that mess up your preferred timeline of getting students fully vaccinated before school restarts in September, or are you moving up that timeline? And if that's the case, then how do you plan to do that?
So we know from the the material that we've already received on all of the vaccines, that a first dose gives you a very, very high percentage of protection. We want to make sure that as soon as we are able to have sufficient supply, that we can expand to our adolescents from 12 to 17, and we will do that. But I think it's really important for people to understand that a first dose of the vaccination gives you well over 50% protection. It means that you're not ending up in a hospital bed or in an ICU bed. And we know that first doses give us a great deal of protection, and we will continue to model that. As we get additional supply, then of course we will look at perhaps shrinking the amount of time between the first dose and second dose, but I really want people to be clear and understand that first doses gives you a great deal of protection against this variant. Thank you.
Last question.
Last question from John McGrath at TVO. Please go ahead.
Is the government considering making the COVID-19 vaccine mandatory for students now that that's on the radar, the way that other vaccines for common diseases are compulsory under provincial law?
So I think it's important to remind everyone that in fact, while there are many vaccines that are offered and provided to young people, there are also medical exemptions that are available. And I would leave it to the medical experts to make those determinations. But at this point, as you know, all of the COVID-19 vaccines that we have been offering in Ontario have been voluntary. Having said that, we know that these vaccines save lives and protect people. And I would encourage everyone, as soon as they are able, to get that vaccine to protect their friends and their loved ones. Thank you.
Follow up, and this is the last question.
Sorry, maybe I should specify this is a question for the Minister of Health, who under the law has the power to designate the novel coronavirus as a disease that somebody is required to get immunized for as a student. Is the government looking at making this compulsory for children between 12 and 17?
Not at this moment, no. It has been a matter of choice if people wish to receive a vaccine. And as you'll know, many young people will require parental consent to have the vaccine or not. If the parents do not wish to have their son or daughter vaccinated and that approval is required, it won't be forced upon them. We encourage people very strongly to receive the vaccine as soon as it's their time to protect themselves and their loved ones, but at this point it will not be compulsory.
Thanks, everyone.
Thank you.